Hi, everybody. Welcome to GW Center for Integrative Medicine Zoomcast. I'm your host, Dr. Kogan, Medical Director, Associate Professor of Medicine, George Washington University. So I want to talk today about the interesting study that came out back in the spring. There's actually two studies now showing almost basically identical result, but only going to present one here. I think it's sufficient, and I don't want to overcomplicate this issue. So what are we talking about? Well, we're talking about use of multivitamins as one of the many tools to prevent slowdown or maybe even contribute to reversal of cognitive decline. So without further ado, I'm going to share my screen and we're going to just drop right into the study. So this is a high quality randomized controlled trial. It's actually double-blinded. The trial called Cosmos Mind, and it's a combination of researchers from Wake Forest and Harvard. So, a esteemed team. The trial was designed in a very complex system. I'm not going to go into great detail because they did do a multivariant analysis and they compared multiple different groups. Some groups had cacao supplements with multivitamins, some just with multivitamins, some just had placebo on both ends. I'm going to skip sort of basic things. I think the controls worked well. I think the randomization was good. Patients were on average in their late 70s. So I think that's very important because it is mimicking very well what we see in general in our clinic. And generally, I think that's when the concerns for cognitive decline becoming quite apparent for a lot of patients. So it's a very relevant study. Now, key question right off the bat, there are thousands of multivitamins on the market, so what did they use? Well, I'm not going to go into how they chose, but they just chose Centrum Silver, which is a quite easy to find product on the market. In my mind, nobody should be taking it for obvious reasons. It's full of fillers and dyes. And in the past, Centrum Silver actually has been shown to have some harm in cardiovascular health. So it's not the type of multivitamins I would ever consider giving to my patients. But put that aside, and we'll come back to the point of which multivitamin to try. So put that aside. Let's delve right into the data. Very large trial, so over 2,000 patients in so-called 2x2. So they had multiple different groups. In fact, if you kind of care about what groups they had, you'd have to scroll all the way down. Of course, I will put the link to the study. So here are the groups. So, the patients were in 70s, as I said, and so they either had cacao plus multivitamin and VM, or all kinds of variants. So there are 4 variants, obviously, either cacao plus multivitamin, cacao minus multivitamin, multivitamin minus cacao, and nothing, just placebo, placebo. So let's kind of go through a couple of critical points. So first of all, let's look at this. So this is a very interesting point in the data. It's a figure 1. It's basically an incident that is triggering some kind of additional adjustment to the cognitive scores. You can see that the multivitamins seemingly had a pretty significant improvement here. I will come back to that because that's actually statistically significant, but it doesn't mean that it somehow prevents or reverses any cognitive decline. What this basically says is that the patients who took multivitamins clearly declined slower. And that is the most important conclusion of the whole trial. In fact, if you're short on time and you don't have any more time today to watch this video, you can just leave here because that's really the summary of the entire trial. But there are a couple of really important intricacies that I do want to highlight. So you take multivitamin and for whatever reason, the cognitive decline slows down. So let's put that aside and we'll come back to that in a few minutes. So what else did they find? Well, if you actually look at the onset of cognitive, what we call mild cognitive impairment or actual dementia, or they define it as a probable dementia, there was no significant difference. It didn't matter whether you took cacao or the multivitamin or both. It didn't really improve your chances of not getting either condition. Now, what do these numbers actually mean? Well, so 0.76 means 24% reduction, but if you look at the actual confidence interval, and you can see that it crosses 1, which means it's not statistically significant, and the p-value of 0.15. But interestingly, cacao here did came close to prevent this, so it's possible that if they'd have a much larger cohort, they would have seen it, but I wouldn't count on that. I think these numbers in themselves are pretty clear. What's interesting here is if you do take multivitamin for a while, you see that in the beginning, you see here that minimal cognitive impairment was decreased by only 9%, but probable Alzheimer's by 24%. Here is similar to the 24% of cacao effect on mild cognitive impairment. But again, nothing here is statistically significant. I don't think it's really data that really means much. Okay, so let's look at one other thing, and this is where things get a little bit interesting and a bit more important. So you can see that there are some things here, and this is just multivitamin because they sort of said, look, cacao didn't really produce much. You can see the numbers here. Very few numbers actually have a very strong statistical significance. But if you look at things like executive function, so how you can literally live your life, calculate things, buy groceries. I mean, those are the executive function. And you can see that actually it appears that there was a significant drop over time. So the first assessment, no difference, but then as the time went by, there was a very big significance. Now, these are the actual assessments. So do they truly translate to a true effect? Like, does that actually mean that someone taking multivitamin have a slower progression of loss of executive function? Well, it's a pretty large study. It's a pretty strong power in terms of the p-value here. So I actually going to say absolutely. This basically tells us that the patients who take multivitamin are actually going to perform cognitively in daily life better than those who don't take it, according to this study. So I'm going to stop sharing and I'm going to do a couple of quick points of summary. First of all, let's go back to the Centrum Silver versus other multivitamins. Well, interesting point. So Centrum Silver has all the synthetic vitamins, so there is no active molecules like methyl B12 or methylfolate, all of the nutrients there in the cheapest form that are often synthetic, meaning that when you take this multivitamin in, you will be needing to convert those molecules to active form. A very good example is vitamin B12. Centrum Silver has something called cyanocobalamin, which is a synthetic version, and your body cannot effectively utilize it for much of anything. It has to convert it to something called methylcobalamin, and it has to do that by taking your own methyl groups and attaching them to the B12. Now, that actually is a pretty complex task. The body has to, well, biochemistry of it is such that you have to have several steps before that can happen. And if you're deficient in those methyl groups, you're actually going to struggle to do that. And then those are the patients who actually Centrum Silver is contraindicated for. And it's about 30 to 40% of population, depending on how you look at the data. So in essence, they show the benefit. And then there's an obvious question, well, what if I give a much better quality multivitamin? Are we going to see a lot better result? Now, of course, the study didn't, I mean, nobody will do a study like this, but my gut feeling and my answer is absolutely. Chances are you will see a better result, maybe not dramatically better, but somewhat better if you take a much better quality multivitamin that has mixed tocopherols, methyl B12, methylfolate, better absorbed forms of other nutrients, including even things like minerals like zinc and copper, which when it's in more of a biologic form, then So here's another fascinating point that we didn't talk. The Centrum Silver, I'm pretty sure, does contain copper. And amount of copper in multivitamins can be quite concerning because basically, in essence, copper has been strongly linked to increased risk of Alzheimer's disease. In this study, it seems to be reversed. Now, key question is the studies that showed that in the past particularly linked synthetic forms of copper and a high dose. Centrum silver has 0.5 milligrams, which would be considered a lower dose of copper. And I think more importantly, it has 15 milligrams of zinc. And I think this is actually a very good ratio of zinc to copper. And I think that's why they did not see any increased risk of Alzheimer's in this study. Because in Centrum silver, so for those who over 50, the ratio of zinc to copper is so high that when you take that small amount of copper, the zinc tends to offset the risk of copper-induced cognitive decline. But anybody else who taking other multivitamins that are not Centrum silver, or you're not my patient, or you didn't discuss this with your provider, make sure that you understand this well, because excessive copper can be pretty problematic for the brain. It's a pretty well-established fact. So let's quickly summarize what we got. Well, seemingly multivitamins can have a pretty important role to play as a whole package of care for cognitive decline. The magnitude of benefit is small overall, but it's consistent. And now there's more than one study. It seems to be easy to, it's an easy product to take, not very expensive. Whether you take Centrum silver or you take some other better quality multivitamin, it probably doesn't really matter. All of the multivitamins price-wise are not all that expensive. I mean, there are some exceptions, but most of them are not going to break your bank, and they may have lots of other benefits. Now, whether or not there are other risks to doing this, particularly Centrum silver, this study specifically didn't address. But as you heard me talk in the beginning, there has been studying showing increased risk of heart disease with the Centrum silver and similar poor, what we call retail quality, not nutraceutical grade multivitamins. So that's up to you. So my recommendation after seeing all of this is that probably most older adults over 70 should be taking multivitamin that is methylated, that has mixed tocopherols, and that has a very high ratio of zinc to copper, meaning that you would have more than at least, ideally close to 20 to 30 to 1 ratio. In the Centrum silver was 30 to 1. A lot of vitamins will be 10 to 1 ratio of zinc to copper. So something like 10 milligrams of zinc and only 1 milligram of copper. I would prefer a much higher ratio. Hopefully this was helpful. Let me know in your comments what you think. We will definitely be continuing frequently reviewing the topic of cognitive decline, and see you back, and we'll talk about all things related to integrative medicine, health, longevity, and wellness. Stay well, friends, and enjoy the rest of your day.